Cognitive Theory, Thoughts to Actions, presented by Ashley Johnson, Jana Merriman, Michael Nelson, and Shelli Ness. So what is cognitive theory? In social work, it's one framework for which to understand human behavior. Cognitive theory says that people's problems are caused by faulty thinking. Our thoughts, emotions, and behaviors are strongly related to one another. Thus, thoughts cause feelings, which then cause behaviors. People can develop these unhealthy thought, feeling, response patterns that can be problematic to their lives. Cognitive theory shares many of its main concepts with behaviorism. Classical conditioning is when a behavior is explained by a stimulus. An example of this would be Pavlov ringing a bell, and his dog salivates because he has been trained to learn he will eat soon after he hears the bell. Operant conditioning is when human behavior is controlled by consequences of an action. Reinforcers are consequences that strengthen the desire to repeat the behavior. For example, a child may earn a sticker for completing a homework assignment. In contrast, punishers weaken the desire to repeat a behavior. For example, a child may not be able to participate in recess because she did not complete her homework. Imitation is when behaviors are learned by observing someone modeling it. In social work, we can teach clients skills through modeling. Cognition is our thought process, including automatic thoughts and core beliefs that affect our emotions and behaviors. Cognitive restructuring is replacing irrational thoughts with rational ones that lead to improved emotions and behaviors. This was an intervention that was created by Aaron Beck.
Hello everyone, my name is Michael Nelson. I'll be providing this portion of the presentation on cognitive theory and the different practice settings that cognitive theory can be put into place. Now, the good thing about cognitive theory is it can be used in diverse settings with diverse populations of clients and with diverse issues. I'll be providing 3 different examples of these settings and different clients that can benefit from cognitive theory. The first is a nonprofit behavioral health facility. These facilities can be used for clients of all ages, and I'll provide one example of a young Native American boy struggling with anxiety at school and receiving individual therapy at this organization. This is a perfect example of how cognitive theory can be used with different cultural backgrounds and age groups, and with anxiety. The second setting is a hospice bereavement support group. And the client is an elderly gentleman struggling with depression due to his wife of 50 years dying. Perhaps this elderly gentleman is struggling with his purpose in life, and through this support group and cognitive theory, it can help him to overcome some of these negative thoughts that he may be struggling with. And finally, the third setting is a substance abuse residential treatment center for teenagers. Again, cognitive theory can be used for all age groups and developmental periods. And in this circumstance, teenagers struggling with substance abuse can benefit from cognitive theory through cognitive behavioral therapy and even in a group setting.
The cognitive theory is well developed and has many strengths. It has been widely studied and there are numerous empirical studies supporting it. It has been proven to be effective with various client groups, including children, adolescents, and adults. It can also be used to treat various disorders such as depression, anxiety, substance abuse, phobias, and several other psychological disorders. The cognitive theory has been combined with other theories such as the behavioral theory, providing a greater explanation for human behavior. The concepts and principles of the cognitive theory are clear and make it highly applicable for many social workers, especially when they are trained on specific interventions. In addition, another benefit is that the sessions are structured, starting with the client's agenda and ending with feedback and an assignment for the client to complete. Another strength of the cognitive theory is that the therapeutic relationship between the client and the therapist is based on collaboration, which enables the client to actively participate in solving their problems. This leads to success in the client being able to utilize the learned techniques long after the therapeutic relationship ends.
Hello class, my name is Ashley Johnson and I will be discussing the limitations of cognitive behavioral theory as a clinical intervention used in social work. Cognitive behavioral theory is a problem-focused approach, unlike strengths theory or solution-based theories, which are prominent in the NASW goals and mission statement. This theory is based on the medical model, which centers around identifying the presenting problem and solving it, rather than focusing on the client's innate strengths and past successes to overcome present difficulty. Labeling persons' thoughts as faulty or unhealthy can become problematic when working with diverse clients. For example, if a clinician identifies with the majority culture and his or her client is a minority or an immigrant, it may be unproductive to use this theory because the thoughts that CBT labels as faulty very well may be cultural related. This can be considered the essence of marginalization. Also, this theory places the clinician in the role of expert, unlike humanistic, strengths-based, or empowerment theories. The clinician has the skills and the knowledge used to identify unhealthy thought patterns and assist the client through the process of reframing and cognitive restructuring. This places the client in more of a passive role and can lead to unrealistic expectations that cause the client to rely too heavily on the therapist for their recovery. Finally, this theory is most often used and has been evaluated in empirical studies in micro-level settings, and there are hardly any macro-level application. This restricts social workers that work from an expert approach, using CBT as their only theory from which to draw their interventions.